Venkata Padma Hospital, senior pediatrician and DNB teacher. This is regarding obesity in children. In the recent past, the obesity in children is exponentially increasing, especially children born after the age of 2000. If you compare 10 years before 2000, the incidence of obesity and overweight in children is very less. But for the past 10 years, it is growing like anything, especially for the urban population. It is around 40% of the children, especially in the primary school areas, primary school time. And even for the school time also, the incidence of overweight is also increasing now. Even in the rural areas also, underprivileged people or children also, the incidence is around 15%. Why we are discussing about obesity in children in the recent past, especially following the post-COVID for the past 3 years? The incidence of type 1 diabetes mellitus, especially in children, the ICMR recent study showing nearly 15,900 fresh cases of type 1 diabetes especially type 1 diabetes in children less than 14 years, and it amounts to nearly 2.5 lakh cases estimated at present in India now. Why we are worrying about the especially type 1 diabetes, especially children with obesity having the poor mental health, and the incidence of non-communicable disease in the adulthood is also increasing, like diabetes mellitus, hypertension, cardiovascular disorders, and cerebrovascular diseases also more now. The difficulty in managing especially children with type 1 diabetes is in India especially is more difficult. Because the number of specialists are very less. The number of hospitals treating diabetes mellitus in children is also very low, and the modern laboratories are also very few, and the attitude of the parents and family members, they are not accustomed for the managing children with type 1 diabetes mellitus, especially food and other insulin, daily administration of insulin to the children is also very difficult many families now. So with this, keep all the people in India, we have to keep it in mind. So especially if there is a strong family history of the diabetes mellitus and hypertension or cerebrovascular disorders or cardiovascular diseases, the incidence of diabetes mellitus in children is also increasing now. So that we can reduce the diabetes by allow the children to do exercise for at least for minimum 60 minutes, and sleeping time for minimum 8 hours. Third one is good eating habits, like avoiding fast foods and junk foods, and the reducing the screen time, especially children who are accustomed to mobile phones or TV for more than 1 hour. The incidence of obesity is also increasing now. So I request all the parents to keep all the things in mind and see that our nation is depend on the children in the future. So keep them healthy. Thank you very much.